I'd like to now invite Alexis Wise to the podium. Alexis is a Senior Manager on Capital Advisory at the Mars Center for Impacting Investment. Alexis.
Great, thank you. Perfect. Well, welcome. This is my house. You guys are here at my workplace today, so this is fabulous. It's great when you get invited to speak and you just have to come downstairs. You might just be wondering why someone from Mars, an organization many of you think of as an entity working primarily with early stage ventures, is here talking to you about sort of policies and mechanisms around healthcare. I wanted to just take a minute to tell you a little bit about Mars and why I'm here today. So, as many of you know, Mars works in healthcare, but we also work across several other sectors, including energy and the environment, finance and commerce, and work and learning. And we have picked these sectors very intentionally for a variety of reasons. These sectors are important because we think they can drive significant human impact, because there's immense opportunity for disruption in these sectors, because there's demand for innovation in all of these sectors, and because Canada and Toronto, Ontario can be a real global leader in all of these sectors. And so these were very intentional choices. But in order to succeed, while we have immense capacity in our ecosystem for invention and for new ideas, whether that's our science capabilities, whether that's our new startups and ventures that are coming through the Mars doors every day, really, we have to also have a conversation about adoption of all of these, and we heard that earlier today. So this isn't just all about good ideas, but it's how we get them into daily practice in our systems. And the health system is complicated. It's hard to do that. I think the number now is sort of 17 years from invention of a new clinical practice to full adoption within a health system. That is way too long given the pace of change in scientific discovery, digital technology. And so we need to find ways to do that better. One of the ways that we feel is an enabler of change, one of the ways to really support this adoption is through business model innovation. And that's the language that we put around this real shift from sort of a activity-based healthcare system to one really focused on value. And that's a theme that you're hearing consistently today. At the Mars Center for Impact Investing, we're experimenting with some very specific types of funding models that really build off of this shift. And I'm going to tell you about a deal that was struck last year. We announced in this room about a year ago today. And this is Canada's first social impact bond, first national social impact bond. And this is really significant for a few reasons. So first of all, I don't know how many of you have heard that term social impact bond. Can you raise your hand if you've heard it? I'm always curious. The numbers change every time. Okay. The reason you may not know that term is it has many different names. If you're looking at the US market, it's called a pay for success deal in the US. And I will walk you through the structure, but what is really unique about this deal and all social impact bonds is that we're asking stakeholders to play different roles than they're used to. So this particular deal I'll walk you through, the Public Health Agency of Canada, rather than traditionally providing a grant contribution to an organization to deliver a service, monitoring the progress, perhaps adding some milestones in that granting arrangement. What's been really unique in this deal is that that government grant has changed to something that we are calling a contingent grant. So money from government is not flowing to the organization, in this case the Heart and Stroke Foundation, unless that organization is actually demonstrating outcomes. And so I'll talk to you a little bit more about that, but that's a real shift. So think about that. As taxpayer money is being spent, how are we linking those dollars to the outcomes that are being achieved? So what's unique is that government now is paying on outcomes. What's also interesting is that the provider then has to figure out, especially when the provider, like in this case, is a not-for-profit Heart and Stroke Foundation, if I'm not going to get my money until I deliver outcomes, how do I actually pay for my services? How do I deliver? How do I have the working capital to demonstrate that I can achieve those outcomes? And so what this model does is go to different funders, go to the private sector and say, can I receive money from you to deliver my services? If I'm successful, I have a guaranteed agreement with government that they will pay me, therefore I can return your capital. So we're really tapping into an increasing interest in a new sector called impact investing. And so this is creating a market, a product to provide to impact investors who are interested in channeling their money to projects, to initiatives that are able to drive both a financial return and a social return. So what was this project that the Heart and Stroke Foundation was interested in growing? There is a program called the Community Hypertension Prevention Initiative. The Heart and Stroke Foundation was very interested in taking this to market at a much larger scale than they would traditionally do, and they wanted intentionally to experiment with new funding approaches. I don't want to go into the changing nature of philanthropy too much right now, but it's harder and harder to raise money. The way that you are engaging with donors is changing, that every not-for-profit is engaging with donors is changing, and donors are increasingly asking for some kind of measurement around what their money is delivering. What am I getting for my money? When I give you my money, what will happen? So the Heart and Stroke Foundation decided, well, we're willing to try a new model. They sought out a group of stakeholders to help them deliver this program. So the program is delivered in local Shoppers Drug Mart locations. It is staffed by Heart and Stroke volunteers. And the way the program works is that an individual will be notified of the program through the Shoppers Drug Mart location by sort of seeing signage there. Their GP may assign them or recommend that they go and see someone at the Shoppers Drug Mart location. A baseline measure of that individual's blood pressure is taken. They are notified if they are prehypertensive, and so the objective here is really to increase awareness for individuals who are prehypertensive. And if they meet the criteria of prehypertensive, they are then offered the opportunity to enroll in a digital platform, and that will support them in improving their lifestyle over the next 6 months. And at the 6-month mark, that individual is invited back, and blood pressure measures are taken again. And payment is only made to the Heart and Stroke Foundation if that individual's blood pressure has been stabilized or has actually improved. There's also payments linked to the number of individuals that are enrolled in the program, because for the Heart and Stroke Foundation and for the Public Health Agency of Canada, the idea that making people aware of their prehypertensive status was significant was relevant to all of the stakeholders at the table. So how does the money work and how does the money flow here? As I mentioned, the first contract that was really in place was the one between Heart and Stroke Foundation and the Public Health Agency of Canada. This is a contingent contract. The Heart and Stroke Foundation then went out and sought private investors. These were high net worth individuals, large foundations, impact investing funds, both within Canada and internationally. Those funds flow to the Heart and Stroke Foundation, who delivers the program, and then success payments are paid to the foundation, who then transfers that money back to investors. And investors do earn a return on their investment in this case. This is really a confluence of several trends, right? So the impact investing trend is not something specific to health. We're seeing this across a wide number of social issues. Payment by results is something that we're talking a lot about in public sector and public service generally, and increasingly trying to get public-private partnerships or multi-stakeholder collaborations together are conversations that are happening at all levels of government and across social issue areas. And so this deal was one of only about 10 health deals that have been done internationally in this space. There are about 80 or 90 social impact bonds already launched globally, so it's still very much an emerging model. But I think it aligns really well with the conversation that we're having in healthcare. So I pulled this quote from a recent World Economic Forum paper that talked about really value in healthcare. And if a principle of value in healthcare is to align industry stakeholders, well, that's also very aligned with this model around social impact bonds, that we're bringing together new stakeholders in new ways. And the importance of shared objectives around improving health outcomes is fundamental to this approach. In order to get investors to the table, in order to get service delivery partners to agree and government to agree, every entity needs to align around the same set of objectives and outcome measures. And then really the relevance of health outcome measures is critical, because none of these deals work without the right data infrastructure behind to collect that data, track it over time, and importantly, allow it to be used for performance management. So the other key principle here is that the service providers are not being micromanaged. They are being provided with the opportunity to make adjustments to their program over a reasonable time frame such that they can deliver on the outcomes that they've committed to. And so if a change needs to be made midway through a program, if a technology adjustment needs to be made, if staffing changes need to be made, if services need to be delivered in another way, that's fine. And as long as the outcomes are hit, that's what's being measured by the funders. What I really like, and I don't see this model as ever being a core funding mechanism for healthcare as a whole. But what I think it does provide at this point in time is a really interesting opportunity to experiment with a new business model within sort of a broader conversation around how we have to make more substantial changes. It creates a safe space for us to learn some of the skills and capabilities that we're going to need as organizations, as individuals, as we think about broader changes in how we pay for healthcare. And actually, it creates a market for some really critical services that are currently not attracting enough funding. So where we're seeing this model take hold is really when we're looking at sort of public health, at disease prevention, at underfunded areas of our health system. So typically sort of on the fringes of the traditional acute care system, that's where we're really seeing great interest in this model. I will skip this, but just to say that, governments, investors, intermediaries, they all have a role to play in building this ecosystem and supporting new models of payment. And, this is new, this is different. It's going to be a little bit scary, but that's kind of what we're trying to do here sometimes. So let's give it a try.